Good evening, everybody. We are here on Facebook Live and we'll be discussing about polycystic ovaries. Polycystic ovaries is endocrine disorder. It's a heterogeneous endocrine disorder in which there are multiple follicles in the ovaries. It is associated with obesity and it is associated with hyperinsulinemia and it is associated with a lot of metabolic disorders and androgenism, and that is why there is hirsutism, acne, and it's a big problem today. We at Lifecare are here to help you to solve your problems and all the myths about polycystic ovaries. So let's begin with some questions about polycystic ovaries. Okay, I think you all are still logging in. Welcome to the Facebook Live channel. And let us discuss something about polycystic ovaries today. And let's know what we should do to see that polycystic ovaries can be treated without much of medicines. See, it is a lifestyle disorder. Lifestyle disorder means something to do with your eating, something to do with your sleeping, something to do with the junk food that is going on, and something that is very important, that is lifestyle. Now, what happens in polycystic ovaries? In polycystic ovaries, there is oligomenorrhea, that is scanty menses, there is amenorrhea, that is lack of menses. There can be people who don't get periods for 6 months together. They can get people who have just 1 day of bleeding per month. Sometimes there are people who have very heavy menses and the bleeding is not controlled. Now when you go to the doctor rules out all other causes like thyroid, adrenal hyperplasia, and then anemia, and then you come to know that you have polycystic ovaries. Oh, there is polycystic ovaries. How do you do your treatment for polycystic ovaries? There has to be a lifestyle modification because you can't eat medicines for life. There has to be a diet modification so that your obesity can be controlled. Also, there are problems like hirsutism and acne, that is excessive androgen. So how do you control the excessive androgen? How do you control the hyperinsulinemia that you are caught in? By doing regular exercise at least for 45 minutes every day, by having a good diet control and by reducing the sugar in your diet, by having lots of proteins, having lots of water, and having a good sleep every day. Now let's see what are the questions that are coming up. Okay, not yet logged in. Come on, log in soon. Fine. So what are the investigations that we should do for polycystic ovaries? A sonography of the pelvis, insulin level, a serum testosterone level, lipid metabolism, so a lipid profile, and what else should we do? The serum testosterone should be a free testosterone level. You should also do your thyroid hormones. You should also do the dehydrotestosterone so that we find out what is the exact cause of the polycystic ovaries. A sonography of the pelvis will show you an ovary which is enlarged in size and that has 9 to 12 multiple follicles in the circumference. What happens is both the ovaries get enlarged in size. There is excessive secretion of androgen, and because of that there is a sclerotic cortex and the quality of the eggs that are produced by the ovaries is less. If you do an anti-Mullerian hormone, the level of the AMH is high. Unlike in infertility where the AMH levels are low. So high AMH levels are subject to polycystic ovaries. What happens if you don't get your periods? Automatically there is obesity. There are two types of polycystic ovaries. One is a thin polycystic ovaries and one is a obese polycystic ovaries. So a thin polycystic ovaries is more difficult to treat because an obese polycystic ovaries resolves once the weight loss happens. What should the person with a thin polycystic ovaries do? They should have a very low sugar intake. A low sugar intake will improve the polycystic ovaries. Now we're getting some questions. The first question is from Munira. What effect can weight loss have on women with polycystic ovaries? Weight loss is very important in polycystic ovaries. Weight loss helps to resolve most of the problems with polycystic ovaries. That is why weight loss is very important in polycystic ovaries. At least 5 to 10 kg weight loss is important. Not only is weight loss important, but you have to sustain the weight loss. If you put on the weight again the polycystic ovaries will come. See, it is a metabolic disorder. In metabolic disorder, what happens is that the sugar content increases. Because of that, you are subjected to maturity onset diabetes mellitus. Along with that, you are subjected to hyperlipidemia, which can cause atherosclerosis, and you are more prone to myocardial infarction as you grow. Being a lifestyle disorder, it is very important that you maintain your weight. The next question. Lots of people logging in, very nice. Hello Sanket, hello Geeta Jain. Can we have some questions from you? Dipali Samant, hello. Something very important about polycystic ovaries is there is an increase in blood pressure as you age. An increase in blood pressure, sometimes also there is a possibility of CA endometrium. So it is very important that polycystic ovaries are treated. Please do not neglect yourself if you are having polycystic ovaries, because there are very serious consequences in the long run. It is very difficult to lose weight when you have polycystic ovaries because of hyperinsulinemia. So there is less involvement of the obesity. The adipose tissues do not dissolve fast. So it is very important that you maintain a good lifestyle, a good diet, and you go on medicines. The medicines that are given today are myoinositol. Myoinositol helps the conversion of the testosterone, and that is why it helps in resolving the polycystic ovaries. Also, it is important that you can take some contraceptive pills if you are not interested in having your fertility. So you can take cyproterone acetate, that is an anti-testosterone that helps to reduce weight, helps to resolve acne, and helps to resume the hirsutism. If you are having excessive androgen, then there are medicines like iodactone or spironolactone that helps to reduce the androgen excess in the body. Also, there are medicines like cytomid or finasteride that reduces the hirsutism. If you are having polycystic ovaries, and with polycystic ovaries, if there is a difficulty in weight gain, then you must follow a good lifestyle, you must eat properly, and you must take your medications. Do visit an endocrinologist or a gynecologist who will help you. Each individual is different, each polycystic ovaries is different, and it requires proper investigation and proper analysis. Also, the age factor is important to see. If you are young and you are not interested in taking hormonal treatment, there are other medicines also that are available which can help to treat polycystic ovaries. If you are in your fertility and you are facing issues with fertility, it is seen that the quality of the eggs that come in a polycystic ovary patient are not good. So to improve the quality of the eggs, a proper lifestyle, a proper diet, and proper management. There's a question from Dipali Sawant. What is common fertility treatment protocol for a polycystic woman? The common fertility protocol is proper weight management, proper diet control, and then initially you are given medicines to like clomiphene citrate for ovulation induction. If you are given clomiphene citrate for more than 6 cycles and it is not working, you are stepped on to a hormone called FSH. With these injections, the quality of the egg that comes is better. At the same time, it is important to maintain your sugar levels. Also, it is important to maintain your lipid profile. And with these medications, if you ovulate and the quality of the egg is good, you will conceive. If you do not ovulate after 12 cycles of proper ovulation, then it is better to step up for IVF. Yes, Dipali? Any more questions? Fine. Now in polycystic ovaries, what we observe is even if you conceive, there are very high chances of miscarriage because of the high sugar levels. So it is important that you maintain your sugar levels and you maintain a proper diet. Along with that, it is also seen that as you approach your second trimester, diabetes sets in, and so you should have proper glycemic control. Metformin is the drug of choice which is generally given to all diabetics throughout their pregnancy to maintain their sugar levels along with proper exercise and diet. It is also seen in polycystic ovaries that the chances of miscarriage are high, so you should follow your doctor very closely and you should eat your medicine on time and you should go for regular checkups. Also, all investigations that are advised by the doctor should be done very regularly. Welcome everybody to all the people who are joining in to watch polycystic ovaries. Routine investigations include proper serial monitoring of your sugar, testosterone levels. Sometimes all reports might appear normal, but in spite of that, we see central obesity, we see hirsutism, we see acne, and it requires regular follow-up and regular investigation and medicines. Lifestyle management is very important in controlling hirsutism, in controlling acne, in controlling obesity, and to reduce the adrenal excess. Welcome people. We are having more people logging in. Sanket Agarwal, any more questions? Gita Jain, any more questions on polycystic ovaries? Polycystic ovaries is a problem that was described by Steen and Leventhal in 1935. It comprises of enlarged ovaries, it comprises of metabolic changes, it comprises of hirsutism, acne. Sometimes in polycystic ovaries, it is seen that the adrenal excess is so much that there is clitoromegaly and there is a masculinization of the female body. Like the muscle mass increases in size, and it is very difficult to treat. So it is very important to understand how you can change your androgen excess. What happens is the pituitary gland secretes excess of GnRH hormone. Because of excess GnRH hormone, there is increase in LH hormone. Increase in LH hormone, it cannot be negated because there is no ovulation. Because of an ovulation, there is no FSH. Because there is no FSH, there is no progesterone. Because there is no progesterone, there is no breakthrough bleeding and there is no period. That is why they are scanty hormones. Excessive LH in the body can cause obesity. Excessive LH in the body causes hirsutism. Excessive LH in the body prevents ovulation, and so there is no period, there is no ovulation, and that is why there are no good quality ova for infertility. Polycystic ovaries is a disease. It's not a disease. Polycystic ovary is a metabolic disorder. So a metabolic disorder requires continuous treatment. It is not that you just take medicine for 1 month, 2 months. It is a lifestyle disorder. So for life, you have to alter your diet, you have to alter your eating habits, you have to alter your exercise pattern, and the medication given to you has to be taken throughout if you are not able to maintain your weight. It is also seen that some doctors do laparoscopic drilling to treat polycystic ovaries. Laparoscopic drilling is a procedure by which the ovaries are punctured at 4 to 10 sites, and that helps in ovulation. Sometimes there is ovulation spontaneously after laparoscopic drilling, but sometimes laparoscopic drilling does not help. So it is still not a certain treatment for ovulation. In vitro fertilization is now being utilized for infertility. In vitro fertilization is a procedure in which multiple eggs are formed. Although multiple eggs are seen to be there in a polycystic ovary patient, sometimes they are empty follicles. There is no ova inside, and there is just water. And in that case, it becomes very difficult for us to help the patient with IVF. So we have to repeatedly do 2-3 cycles. Once we get the quality of egg, that is the ovum, after that also, in spite of having good quality embryos, it is seen that they don't take up. So it is important for polycystic ovaries patients to have good diet, to have good insulin control, and to prevent them from being unhappy after an IVF cycle, they should be counseled that it is not necessary that in spite of IVF, they will be able to conceive and they will be able to have proper embryos and proper pregnancy. Even during the pregnancy, it is seen that the rate of miscarriage is high. Also, it is seen that in the second trimester, they develop diabetes. So, it is very important for patients with polycystic ovaries to follow up regularly with the doctor. It is also seen in polycystic ovaries that the sugar levels keep changing, so it is better to maintain their sugar, and it is better to maintain a high protein diet and to have plenty of water because it helps in maintaining the weight. Also, it is seen that there is a chance of developing high blood pressure towards the third trimester. So a low salt diet will always help patients with polycystic ovaries to maintain their blood pressure and maintaining sugar and proper serial follow-up with the doctors will help to give you a healthy child. We are having more people logging in, and we see Babunand Yadav joined in, and Deepali Sawant. We just been diagnosed and I'm overwhelmed. Where do I begin? How does polycystic ovarian syndrome affect my fertility? Deepali Sawant, it is very common to be diagnosed with polycystic ovaries. As I have discussed before also, a good lifestyle, that is a good diet, high protein diet, a low carbohydrate diet, plenty of water, plenty of fruits, plenty of vegetables will help in maintaining the insulin level. Along with that, low sugar and good exercise, a very energetic exercise, something like burpees with plenty of squats and running will help you to reduce the insulin levels. Along with that, if you are doing well and if your polycystic ovary is getting this, you should be very happy. Happiness quotient is very important in resolving polycystic ovaries. See, it is a endocrine disorder, so it is something that will remain with you if you are able to maintain a good happy quotient, a proper diet, and exercise. There is no need for medication. If you are not able to resolve the polycystic ovaries with diet and with exercise, then you will have to go on to some form of medication. If you are going in for infertility treatment, they will start off with myo-inositol. Myo-inositol helps to resolve the polycystic ovaries and give you better quality ova. Along with myo-inositol, if the quality of egg is not coming up, they will start with clomiphene citrate. If clomiphene citrate helps you to get a good quality egg, then that's good enough. If it doesn't help, then the next molecule that is there is letrozole. Letrozole is given 2.5 milligrams daily or 5 milligrams daily. Sometimes it can go up to 7.5 milligrams daily. If the quality of egg is good, then they will not put you on hormonal treatment. They will monitor it regularly with a follicular study. If you do well with letrozole, then there is no need for hormonal intervention. Then they will not do something more. But if it's not possible to get a good quality egg with clomiphene or with letrozole, then they will step up to something called FSH. FSH is a hormone that is not being secreted because of the high levels of LH. So to break that, they will start off with low dose of FSH, and with FSH for 5 days from the second day of the menstrual cycle. If they are getting a good quality egg and it is seen on follicular study, and also if they see that the estradiol levels are good, then that should help you and that should be good enough for you to conceive. In infertility, it is also important that the male partner's semen report has to be good. Along with that, it is important that your tubes are patent, and other factors are also important, like your thyroid levels and your vitamin D levels. Vitamin D contributes also to polycystic ovaries. So all the girls who are vitamin D deficient, please see that your vitamin D levels are improved because vitamin D deficiency also causes infertility. Vitamin D deficiency also causes high BP during pregnancy, and vitamin D deficiency is also responsible for polycystic ovaries. Also, it is seen that vitamin D deficiency causes cardiac problems. So, it is very important that your vitamin D levels are proper. Hello, Savita Pandey. Some more questions from your side. So, polycystic ovaries overall we have been discussing is a disorder which is a metabolic disorder in which we see that the ovary has multiple follicles, and along with that there is hyperinsulinemia, that means there is insulin resistance. So, there is a tendency for diabetes. It is seen that there is hyperlipidemia. So, there is a tendency for central obesity. Central obesity means there is an obesity on the stomach. There is excessive androgen, so there is excessive hair growth. Also, it is seen that there is acne, there is masculinization of the female, and because there is amenorrhea or there is anovulation, and there is difficulty in conceiving. It is seen that people have been trying to conceive for years together and not able to conceive because they are not following the very basic things of lifestyle changes and of diet and exercise. These three things are very important. Just taking medicines, just seeing good quality eggs is not sufficient. It doesn't help. It is very important to maintain a good lifestyle, to be happy, and to do regular exercise. It helps to correct polycystic ovaries. Lakshmi Rathod, what is insulin resistance? Insulin resistance means there is a resistance to the food that you eat. If you eat sugar, it is not getting metabolized, and that causes diabetes. So that means there is enough of insulin in the body. The insulin levels, if you do the fasting and the PP insulin levels, they are high. Although the insulin levels are high, they are not able to metabolize the sugar that you eat. So in spite of having excess of insulin in the body, it is not able to metabolize. To create this sensitization of the insulin, we add a hormone called inositol, which helps to sensitize the insulin and utilize the insulin for digesting the sugar that you eat. Because of insulin resistance, there is a tendency to get diabetes. Although there is enough insulin in the body, it is not being able to be utilized. That is why sometimes metformin is also given to polycystic ovarian patients to improve the insulin resistance. Have you understood, Lakshmi, what is insulin resistance? Yes. Hello, Meena Jain. So what happens is the insulin that is in the body is not being utilized because of lacking of the hormone. So myoinositol improves the utilization, and that is why myoinositol is being given, because metformin had a lot of side effects like giddiness, diarrhea, and it was not able to cure polycystic ovaries. However, metformin is added to improve the insulin resistance and to prevent diabetes once people are pregnant throughout the pregnancy till they deliver. Once they deliver, we stop the metformin and sugar levels come down, and there is no need to eat medicine, but you must maintain your lifestyle and you must maintain your diet and exercise because it helps in preventing polycystic ovaries. Polycystic ovaries do have long-term complications. It is seen that myocardial infarction and hypertension persists even after you complete your infertility treatment, you have your babies, but polycystic ovaries doesn't get over, it continues. So because it is a lifestyle disorder, you have to improve your lifestyle for life. You have to eat on time, you have to eat proper diet, you have to do exercise, and you have to remain happy. You have to maintain your state of mind because stress is an important factor which is seen nowadays, which is causative for polycystic ovaries. Thank you, Lakshmi. I hope you have been able to understand, and thank you for logging on. Thank you all friends for logging on, and it has been a very nice discussion on polycystic ovaries. If there are any more questions, please ask. It will be good because we can share with you some of the insights on polycystic ovaries. In polycystic ovaries, what I have observed is the women are obese. I have seen a young girl today, a 19-year-old girl, who has been working out on her amenorrhea issue for last 3 years, and she had lost weight and gone down to 60 kilos from 85 kilos, and she bounced back to 85 kilos the minute she stopped exercising and she stopped following her diet. She has been taking lots of medications and she was really upset, and then I explained to her that there is a definite need to continue diet and continue exercise. She's only 19 years old and she's worried that will I have infertility. I'm seeing my friends facing problems of infertility, and I'm seeing a lot of girls who have had miscarriages. I'm worried about my future. And I explained to her that worrying is not the solution. She has to follow a diet, she has to follow a lifestyle, and she has to exercise every day, and that is the only thing that will help her to overcome the polycystic ovaries. And just medicine is not going to help. People have been eating medicine for years together, not understanding that it is not only medicine, it is lifestyle and diet that is going to help them to overcome the polycystic ovaries. Also, because of diabetes, we know that pregnancy is complicated. There are many abnormal children that are born because of high sugar levels. So diet, lifestyle and medication, all three together are important in achieving your goals of curing polycystic ovaries. Lots of people ask whether homeopathy should be taken or Ayurvedic medicine should be taken. All medication is fine, but it is more important that lifestyle is maintained, diet is maintained, and a good 45-minute exercise at least thrice a week is important to maintain your hyperinsulinemia and to maintain the metabolic disorders that occur during polycystic ovaries so that you can overcome them. It is very important to maintain a proper BMI, that is a proper height-weight ratio. It helps in overcoming polycystic ovaries. Also, it is seen that polycystic ovaries has led to endometrial cancer because there is persistent amenorrhea, so there is thickening of endometrium, and there is no shedding of the endometrium, and suddenly it comes as a shock that why is there such a thick endometrium and why endometrial cancer. That is because of the hormonal influence of polycystic ovaries. So it is very important for all women to get checked regularly for pap smears and to see a sonography and to see how thick the endometrium is. Recently, lots of women are scared because they were not aware that just not getting periods is not only a simple thing, but it is something that can have very serious consequences like endometrial cancer, hypertension, myocardial infarction. So it is very important for all women to keep check and to resolve the problem of polycystic ovaries and to maintain their weight and to maintain their lifestyle so that it does not hit them and they are able to overcome the problems of polycystic ovaries. Geeta Jain. Does exercising help in this condition? Yes, a rigorous exercise is very useful because it improves the BMI and it improves the circulation and it helps to reduce the resistant insulin and thus it helps to resolve polycystic ovaries. Hello Purnima. What tests have to be taken? Sonography of the pelvis will show the ovaries and the size of the ovaries and the number of follicles that are there. Peripherally situated follicles are seen in polycystic ovaries. The volume of the ovary is bigger compared to the normal ovaries. Also, it is seen that serum testosterone is high. Also, serum insulin is done. And also, it is seen that thyroid abnormalities may be seen in polycystic ovaries. Also, if you do the lipid profile, you will see the serum cholesterol is higher compared to girls without polycystic ovaries. Mostly serum-free, serum testosterone, sonography of the pelvis, and other androgenic signs like hirsutism, and just blood tests and sonography is sufficient. Also, if you do lipid profile, you see that polycystic ovaries show increase in cholesterol and triglycerides. Yes, Roshali, what can be done to increase the chances of pregnancy for women with polycystic ovaries? Good lifestyle, proper diet, exercise, eating methi seeds is good because it helps in insulin sensitization, or methi water. Methi seeds can be soaked at night, and taking that water also will help in improving the polycystic ovaries. Being happy, trying to keep yourself occupied will improve your chances of getting pregnant. Yes, Purnima, is PCOD always with hyperinsulinemia? Mostly, yes, PCOD is always with hyperinsulinemia. There is an insulin resistance, that is why there is no ovulation, and it is always seen with PCOD. What is PCOD and PCOS? PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. Syndrome is a metabolic disorder that is associated with obesity, hyperinsulinemia, and hyperandrogenism and central obesity. And PCOD and PCOS are two little different things. D is disease. We don't call polycystic ovaries a disease. It is a metabolic error. And to correct this, we have different diets that are given, and they are exercises. Yoga also helps in polycystic ovaries, but most strenuous exercise is more useful. Yes, Purnima? Thanks, ma'am. Thank you so much. And some more information on polycystic ovaries is generally everybody has conceived till now. All the girls who were under treatment for polycystic ovaries and infertility. So there's nothing to be scared. It's only early realization and happy realization, and follow up with the doctor. Lots of girls who came to me said they were told that they'll never be able to conceive because of polycystic ovaries, but eventually they have conceived. They are proud parents, and they have maintained their weight because they have understood the trick, that is proper weight and proper diet, and they have prevented themselves from getting diabetic and hypertensive by following a healthy lifestyle, and I'm proud of them. Lots of them were very obese when they came, and they were taking medicines for thyroid and diabetes throughout the pregnancy, but post-delivery they have really done a good job, and they have maintained their weight and maintained their sugar levels, and they are off medication with just good lifestyle and exercise and diet. PCOD, PCOS, a lifelong problem. Yes, it is a lifelong problem, and to maintain it and to be aware, it is very important, because you should not forget the minute you conceive that yes, you were suffering from PCOS. It will disappear if your weight is maintained. It will disappear if your lifestyle is maintained. There's nothing to be scared about it. It's just an alteration of lifestyle, and you will be fine. Can you tell us what is the cause of PCOD? The cause of PCOD is stress, a very stressful lifestyle. See, all the hormones in the body are situated in the brain, and the pituitary secretes increased GnRH. Increased GnRH causes increased LH. Increased LH prevents FSH from being secreted because there is no feedback to the brain that LH is increased, and because of increase in LH, there is increase in PCOD, and it is a hormone that is secreted by the brain. So for the brain to stop secreting this increased GnRH, it is important that happiness is there, and you should have a less stressful life, and you should be more happy. And I think good eating habits and good lifestyle keeps you happy and keeps the brain happy and will help you to prevent PCOD and PCOS. How do we come to know that we have PCOS or PCOD symptoms? Going to the doctor will check you, examine you, and suggest a sonography. A sonography report which shows increased ovarian volume, peripherally situated small cysts is suggestive of polycystic ovaries. Along with that, increase in testosterone hormone. Blood test will tell you. Increase in insulin will tell you that you have polycystic ovary syndrome or polycystic ovarian disease. So blood test and sonography is diagnostic. Most of the girls, because they face acne or hirsutism, land up going to the skin specialist. The skin specialist generally give you hormonal pills like cyclotirone acetate or placenta or yasmin, which are specifically meant for reducing acne. Suppose cyclotirone acetate doesn't help in reducing acne, they put you on to something called isotroin. Isotroin also helps in reducing acne, that is increase androgen excess, but it is temporary. To get off the problem, it is important and mandatory to follow a very good diet. Good diet means adequate food. It doesn't mean starvation. It means having plenty of water, having proper food, proper homemade food on time, and reducing the sugar content in the food. Sugar is dangerous because sugar is not being able to be metabolized because of hyperinsulinemia, because there is resistance to the sugar metabolism. So it is important to reduce the sugar in the diet. It is important to reduce the carbohydrate in the diet because carbohydrate gets converted into sugar, and it is important to maintain a good exercise at least 3 times a week. Just walking will not be sufficient. You require rigorous exercise, something like squats, burpees, and yoga will help, yes. And it is important that you know that PCOS will remain with you if you will not follow a good healthy lifestyle. You will maintain a good healthy lifestyle to prevent yourself from getting PCOS and prevent yourself from having the complications because of PCOS. How do we come to know that we have PCOS or PCOD symptoms? Shaista, you come to know that you have PCOS or PCOD symptoms because you see that you are becoming obese, your periods are irregular, either they are scanty or they are very heavy or there are no periods, and you get hair growth and you get acne and you start becoming obese, and in spite of doing exercise you are not able to lose the weight. So you are worried that why am I not losing weight? Then you go to the doctor will do a sonography, will see the polycystic ovaries, do the blood test, come to know that there is increased testosterone, there is increased insulin in the blood, and then will suggest medication or diet and exercise, and you will be able to overcome polycystic ovaries with the help of the doctor. Each polycystic ovaries is different. Each polycystic ovaries requires different medication. Each person has a different cause for the polycystic ovaries. It is not a very general thing. So you need to go to the doctor and see the doctor. Although lifestyle is a common solution, diet is a common solution, exercise is a common solution, medication has to be individualized depending on the reports of the patient and depending on the age of the patient and the requirement of the patient. See, school-going girls with polycystic ovaries may not require medication, but definitely girls who are interested in conceiving, who are facing infertility problems, require medication depending on the weight, depending on the BMI, depending on how sensitive the ovaries are and how they are responding to the different medications like clomiphene citrate or letrozole or FSH hormones. And then one more thing is seen is the eggs don't rupture once they are formed. So they require repeated stimulation with either lupride. Also, it is seen that girls with polycystic ovaries, when they are undergoing IVF, have a very high chance of ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome is a very dangerous thing in which there is loss of extraperitoneal fluid. This happens because the trigger that is given for IVF is generally HCG. HCG can cause sustained increase in the number of follicles that rupture. Sometimes it is seen that even after ovum pickup, some follicles remain or they come later on. The primordial follicles grow slowly, and it is seen that even after the ovum pickup, certain eggs are seen in the ovaries and they rupture and they cause the fluid shift from the intraperitoneal compartment into the extraperitoneal compartment. Sometimes pleural effusion is formed. So it is very important that HCG is avoided in patients as a trigger when there is a polycystic ovaries, and lupride is given because it is safer, and nowadays we see lesser chances of OHSS, that is ovarian hyperstimulation syndrome. So polycystic ovaries is a complex metabolic disorder, and although it seems very simple that just lifestyle modification and diet and exercise will help to resolve, it has to be maintained. It is not a one-day thing, it is not a 1 month thing, it is not a 9-month thing till you conceive and you overcome it. People have been working hard for years together to overcome the problem, and they have overcome the problem with good lifestyle maintenance and with a good diet and good follow-up, and it is possible to overcome polycystic ovaries. It is not difficult, but it is very important to take the guidance of your doctor when you are getting treated for polycystic ovaries. Don't run away, face it. It is easy to face unitedly with the help of the diagnostic centers, with the help of the doctors, and with a good dietitian, good gym instructor who will help you to overcome the problem and maintain a good lifestyle and prevent you from getting endometrial cancer, prevent you from getting hypertension. And it is not difficult, but it is important that you go regularly to the doctor, keep changing your diets as per the requirement, keep changing the exercises as per the requirements, and follow the medications very rigorously, and it is not difficult. Just remember that all of you are there watching polycystic ovaries because it is affecting you, and it is affecting very many girls in their adolescent age group. Almost 80% of Asians are facing this problem. It is not a common problem, it is not a small problem, it is a very important problem, and we must all unitedly face it by changing our lifestyle so that nobody in the next generation is seen to be having polycystic ovaries. Although it is a genetic problem, and we are seeing that it is a genetic recessive problem, and always it is seen that the girls and the relatives who have it in a group of people. It is seen that Asians have a very increased proneness to polycystic ovaries. That is because of our lifestyles, and so we must improve our lifestyle, we must improve our diet, we must improve our exercise pattern so that we can overcome polycystic ovaries. Even if it is genetic, I have seen most of the girls conceiving by them following up regularly. So it is not impossible. So thank you everybody for logging into and thank you Lifecare once more for giving me an opportunity to talk on polycystic ovaries.